The World Health Organization, WHO, has officially declared the end of the global COVID-19 health emergency. After a 3-year stint, the World Health Organization lifted COVID-19's global emergency status on Friday. The virus, responsible for the loss of 6.9 million lives, must now be managed alongside other infectious diseases. During the Emergency Committee meeting held on Thursday, the Global Health Agency recommended that the UN declare an end to the coronavirus crisis as a public health emergency of international concern. This declaration, which had been in effect since January 30th, 2020, marked the highest level of alert. WHO Director General Tedros Adhanom Ghebreyesus announced with optimism that COVID-19 was no longer a global health emergency, but cautioned that it still posed a threat. In a lengthy conference call to the press, members of the WHO became emotional and encouraged countries to take time to reflect on the valuable lessons learned during the pandemic. Maria Van Kerkhove, the technical lead on COVID-19 at WHO, reminded us of the fire pyres and graves that serve as grim reminders of the pandemic's impact. However, there is a glimmer of hope as the death rate has slowed from its peak of over 100,000 people per week in January 2021 to just over 3,500 in the week ending on April 24, 2023, as per WHO data. This can be attributed to widespread vaccination, better treatment options, and population immunity from prior infections. Terminating the emergency could result in ceasing collaborations or funding from international sources, or redirecting the focus towards different regions. However, numerous entities have already adjusted to the virus's decline in various areas. Although the pandemic is receding, the battle is far from over, and Michael Ryan, the WHO's Emergencies Director, warns that deficiencies in the system will be exposed by this or any other virus. These shortcomings must be addressed to prevent future crises. The WHO refrains from formally announcing the onset or conclusion of pandemics, but it did commence describing COVID as one in March of 2020. According to Ryan, pandemics typically conclude only when another pandemic emerges. In 2020, President Joe Biden declared an end to the pandemic in the United States. Following suit with other nations, the world's largest economy is gradually lifting the domestic state of emergency for COVID-19. The official end to this state of emergency is slated for May 11th, relieving the government from funding vaccines and testing for many citizens. Responsibility for these measures will shift to the commercial market. The European Union announced a similar end to its emergency phase in April of last year, and other regions have since followed suit. The declaration from the WHO regarding the gravity of the public health problem is notable. It follows China's recent decision to lift its strict COVID measures, which led to a significant uptick in infections just 4 months later. The recent decision by WHO advisors indicates their belief that a new and more perilous variant of the coronavirus is unlikely to emerge in the near future, despite the virus's unpredictable nature. WHO Chief Tedros assured that he will not hesitate to call for another emergency committee meeting if the situation demands it. Across the globe, testing rates have drastically declined and mask wearing has become less common. Nevertheless, some nations have reintroduced mask-wearing protocols during COVID flare-ups. The WHO recently released a plan detailing how countries can coexist with COVID for an extended period of time. Health systems worldwide will continue to face difficulties from COVID, including long COVID, according to leading infectious disease experts. Epidemiologist Mark Woolhouse of the University of Edinburgh warns that the WHO's plan should not be taken as an indication that COVID-19 is no longer a pressing concern. There is no doubt that it continues to pose a major public health issue and is expected to persist for the foreseeable future. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.